We're going to kick things off this week talking about toe pain and some different foot and ankle stuff. We are about to start with the World Cup stuff here in the United States. We are in Kansas City, the self-proclaimed soccer capital of the world. We've seen and treated a few soccer injuries over the years, and we're going to talk about some of our favorite ones to work with. So we're talking a little bit about prevention. We're going to talk a little bit about treatment, how that looks for us, maybe getting integrated in with some other professionals out there, and then also some stuff you can do at home. So very first off, we're going to talk about a common one with a lot of athletes, and that is foot and ankle pain in general. There's a lot of foot pain, and of course, a lot of things that are painful in the foot get labeled as plantar fasciitis. Plantar fasciitis can actually be a handful of different issues and different problems, but that's a different video for a different day. But if it actually is a true plantar fasciitis, one of the things we can definitely work on is getting the calf muscles and the joints of the ankle and the foot loosened up on the chiropractic side. On the prevention side of this is a very difficult with this sport. Working with athletes in the past, they really like wearing very tight, very small shoes, especially when they're trying to play soccer, because it gives a little bit more control. Typically for these cases, when our patients come in and they're not playing soccer, we recommend that they get some wider shoes, some larger shoes, and some different ones and stuff like that. Kind of difficult to do for soccer players themselves, so that's why we give them some different strategies to work on while they're at home and while they're recovering, to really start to try to get some mobility back in their feet and in their ankles. Along with that, calf strength and ankle strength and foot strength are also going to be very beneficial to start doing, because you start to make some different muscles stronger. It takes the work off of the plantar fascia, and the foot and the ankle are able to handle more stress and manage more load, especially as the season progresses, because as the season goes on, that's where we tend to see a lot more injuries starting to happen and develop. The other one along with that we see quite a bit is turf toe. This turf toe happens for a lot of the same reasons. The front of a soccer cleat is very, very small, or is smaller than some. The big toe gets jammed around, pushed around a lot. It's doing a lot of contact. It's kicking the ball. It's getting kicked by other players. It's kicking other players, all that fun stuff. And that can cause some issues around the muscles and the ligaments around the big toe itself. So still very important to keep lots of foot strength, keep lots of ankle and foot mobility. And that's going to be huge going forward for anyone who is dealing with any of these issues. If you're in the Kansas City area and dealing with any of these kind of issues or anything else, sports or injury related, we'd love to help you out. Feel free to reach out or drop the comment below.